anatomy of the perineum and vulva. And okay, so perineum is it is a diamond shape area. Okay, it is a diamond shape area. It is bounded anteriorly by the pubic symphysis and anterolaterally by the ischiopubic ramus. Okay, and posteriorly by your coccyx and posterolaterally by the sacrotuberous ligament, and this is the ischiotuberous ligament. And if you draw a line along the ischiotuberous ligament, that you will get it imaginary line that is divided in the this perineum into two triangles, that is your anterior triangle and your posterior triangle. The anterior triangle is called as the urogenital triangle and posterior is the anal triangles. Okay, then you can see these the basic structures over the vulva. The first structure is your mons pubis, then prepuce and frenulum. You can see the prepuce, in between the prepuce and frenulum there will be glans clitoris. Okay, this is the mons pubis, this is the scarpa fascia, and this is your prepuce and it is your frenulum. In between the prepuce and the frenulum you will get your glans of clitoris. Okay, you know there is a two lamella. Actually there will be two lamella of the labia minora. The anterior lamella, the upper lamella is from the prepuce, the upper lamella is from the prepuce, and the lower lamella of the labia minora, this is the lower lamella of labia minora, is from the frenulum. In between the prepuce and frenulum this is the glans clitoris. Okay, this is your labia majora, this is your labia minora. External urethral opening, vagina, forceps. Forceps is the labia minora posteriorly is joining towards posteriorly, it is from the forceps. And this and perineal body is here. Perineal body is here, and this is anus, this is the ischiopubic ramus, collis fossa, fossa navicularis is the space between the posterior vaginal wall and your forceps, fossa navicularis. Okay, here you can see, if you take this part, this is the labia minora and the heart lines. Heart line is basically this is the demarcating line between the stratified squamous keratinase. This is the, again you see, if it is a labia minora has two epithelium, that is the outer is stratified squamous keratinase epithelium and keratinase, but then this is the demarcation line. Okay, this is the demarcation lines that in after that demarcation line medial to that you get a stratified squamous non-keratinase epithelium. So this demarcation line is called as heart line. Very very important question they can ask, heart line, what is heart lines? Okay, the next is vulval anatomy. Basically in the vulva there is the most important things is labia majora and minora. This differentiations have to remember. The labia majora is a keratinase stratified squamous epithelium. In the labia minora there will be two epithelium, that is outer and inner. The outer is the keratinase stratified squamous epithelium, inner is your non-keratinase stratified squamous epithelium. And basically the labia majora is having hair follicles, and labia minora doesn't have hair follicles, is absent hair follicles. Okay, and the labia there will be a sweat gland will be present and sweat gland will be absent in the labia minora. And labia majora usually reach in subcutaneous fluid, and sebaceous gland is present in the labia majora, and sebaceous gland also present here. Okay, so labia majora important point is the surgical anatomy here. The applied anatomy here is the labia majora. The incisor of the round ligament is inserted in the upper border of the labia majora. So basically the what is the applied anatomy, you know, the round ligament is inserted at the upper border, so there will be chances of round ligament leiomyoma. Round ligament leiomyoma at the incision of the labia majora is very rare, but there will be chances. Another thing is the obliterated vaginal process of vaginalis, that is the embryonic part, the canal of Knock, that can be dilated at this location, that is the incision of the labia majora. Okay, so basically the applied anatomy here. Another thing is applied anatomy, the basically the glands applied under the apocrine gland, this apocrine ecrine, because you know the labia majora has the sweat gland. Okay, labia minor doesn't have any sweat glands, and it also has a hair follicle, so sweat gland has to be there because hair follicles need sweats to growth. There's oily secretions has to be, the lubrications has to be done the sweat hair follicle, so to prevent roughness. So applied anatomy here is the apocrine sweat gland. The apocrine sweat glands in labia majora can be blocked or infected. That will cause as a hydrative suppurativa, and if it is infected or chronically infected, that cause neoplastic changes, that is called as hydroadenoma. Okay, so basically I told the lack of hair follicles and ecrine or apocrine glands seen in the labia minora doesn't have any hair follicles or eccrine or apocrine, that is the sweat gland. But both have sebaceous gland, but sweat gland is absent in labia minora. Another things you have to remember here from this paragraph is heart lines. From this statement, heart line is the demarcation line between the statified squamous keratinous epithelium versus stratified squamous non-keratinous epithelium. Okay, so from this you remember this much. Next is, I already told the clitoris is the most female's erogenous organ, that is it is located beneath the prepuce and frenulum. Prepuce is the clitoris that has a two lamella. The labia minor has two lamella. The upper lamella is from the prepuce and the lower lamella is from the frenulums. Okay, this is the part already I told. Okay, so heart line, these are the statements you should remember. Another thing is clitoris. Basically the blood supply, the clitoral body is supplied from the deep artery of clitoris, and the prepuce and glans has different blood supply, that is the dorsal artery of clitoris, and majority is supplied by the internal pudendal artery. You can see the cross sections. The clitoris has a cross sections. You can see this will be corpora cavernosa is the septums and the deep dorsal artery inside the corpora cavernosa, and the part of the clitoris you can see there is a glans of clitoris. Okay, then there will be a this is your body of clitoris, the separated tunica vasa albuginia. Then you can, these are two crocks of the clitoris, that is over the ischiopubic rami, and the both blood supply you can see the dorsal nerve and artery of the clitoris and the dorsal vein of the clitoris. Okay, so body basically dorsal artery of clitoris, and the prepuce and glans body is deep artery of clitoris, and prepuce and glans is from the dorsal artery of clitoris. So these are the statements you should remember from this paragraph, and from this image based they can ask image based question also. Okay, so another thing is Bartholin glands. I told the Bartholin gland has a important is if you block or infected, it called Bartholin gland cyst or abscess. The applied anatomy here, and the another is the paraurethral gland, that is the skinny gland. The paraurethral gland, if you obstruct that, they are called urethral diverticulums. Okay, so vestibule, it is the almond shaped space area that is enclosed by the heart line laterally and the hymen medially and the clitoral perineum anteriorly and the porcity is posteriorly. So it is again the vestibule has 6 opening. The already I told this is the vaginal opening. This is the 2 Bartholin gland, the 5 o'clock and 7 o'clock positions, and this is the urethra and 2 urethral paraurethral gland, the skinny glands. Okay, so another things. Then minor vestibular gland is also the drainage of Bartholin gland is 5 o'clock 7 o'clock. Minor vestibular gland drain into the along the heart lines. Okay. Next statement is the vaginal length is non-cranial stratified squamous urethral length is 9 to 10 centimeter, and then true virgin versus false virgin. That in the true virgin the labia majora is usually apposed, and the minora is true virgin case, so it should be apposed, not protruding. Labia minora not protruding. Vagina is narrow and hymen is intact. But false may there will be a labia majora usually not apposed. Okay, that is false. The roomy vagina will be there. That is falsely you tell this patient is virgin because the labia majora is not apposed. So it look like not virgin because of roomy vagina, and hymen is also intact. So differentiation you do by the true vagina, true virgin versus false virgin. The labia majora is not opposed. Okay, these are the rectouterine space and the vesicouterine spaces. Okay, then normally the vagina lacks glands, very important statement. But how the secretion will come? Lubrication, how it is coming? The lubrication basically the transudate. This is the transudate from the vaginal subepithelial plexus. Okay, so basically this transudate secretion when during pregnancy it will increase in the because of increased vascularity the secretion will more. So in sometime due to increased vascularity the secretions more, so that it will confuse with your amniotic fluid leakage. So it should be differentiation has to be done. Then vaginal supply, proximal, distals, and the posterior vaginal. Proximal is supplied by the cervical branch of urinary because proximal part, and the distal part is the lower part, that is supplied by the internal pudendal artery, and the posterior wall of the vagina is supplied by middle rectal artery because the rectouterine septum will be that is the supply by the middle rectal artery. Very very important. You just correlate anatomically, then you get everything. Okay. Then sometimes what happen during after the, if you because you cutting the vaginal surface epithelium, sometimes the surface epithelium buried inside your vaginal mucosa, so that is called epidermal inclusion cyst. Okay. Then next is your perineal body. This is a very very important statement. Perineal body, normally the perineal body is 3.5 to 5 centimeters normal length, but sometimes it is increased 65 to 65% during the second stage because of stretching effect. Usually you are incised during your episiotomy incisions, and it will usually turn during the second or third and fourth degree perineal tear. The most of the things are inserted at that location. The muscles, that is the bulbous spongious, superficial transverse perineal muscles, and fibers of the external sphincters, perineal membrane, and fiber of pubococcus. These are structures has been inserted at the level perineal body. Perineal body is the most important structure. It will prevent prolapse, and if it is weak, then there will be a posterior vaginal wall weakness. Okay. Then the urogenital triangles are again divided into superficial perineal pouch and deep perineal pouch. The space between the superficial layer of investing fascia of perineal muscles and the perineal membrane is the superficial perineal pouch. It contains what are the structure, that is 6 structure has to be remembered: the body of the clitoris, and the bulb of the vestibules, and the greater vestibular gland, and ischio-cavernous muscles, and bulbous spongious muscles, and superficial transverse perineal muscles. Okay, these are structures in the superficial perineal space. Superficial perineal pouch out all clitoris, its scura, and bulb of the vestibule, greater vestibular gland, that is the Bartholin glands, ischio-cavernous muscles, bulbous spongious muscles, and superficial transverse perineal muscles, and branches of pudendal knob and vessels. Okay. So these are the structures you should remember. In the deep perineal pouch, the structure has total 4 structure. One is perineal membrane, external the sphincter, striated sphincter complex has to remember, that is the external urethral sphincters, compressor urethrae, sphincter urethral vaginalis. These are the structures, that is the total is the striated urogenital sphincter complex. You can see this striated, that is the urethra, this is the sphincter urethra muscles, and compressor urethral muscles, and this is the uretrovaginal sphincter. This all three is called as a striated urogenital complex, sphincter complex, sphincter urethrae. This is the circular. Then this is your compressius. This is your uretrovaginal. Okay. So all three plus perineal membrane in the deep perineal pouch. Next is your pelvic diaphragms, the external sphincter, internal. Another apply anatomy of the clitoris is very important. During your hysterectomy, if you're doing a radical hysterectomy, sometimes what happens, the inferior hypogastric plexus, during a radical hysterectomy, the inferior hypogastric plexus injury has been happened. Okay, or you doing extensive perineal surgery, that time there will be injury to the inferior hypogastric plexus, because you know the autonomic innervations of the corpora cavernosa of the clitoris, erectile tissue of this body of the female part, it is originated, the nerve supply from the inferior hypogastric plexus, the fiber that is traveled from the paravaginal paraurethral tissue beneath the pubic center. So if you injure the inferior hypogastric plexus during the radical hysterectomy or extensive perineal surgery, that lead to varying degree of sexual dysfunction in the patients. So these are the nerve supply of the vulva and perineums. We'll discuss later part. Dorsal nerves of clitoris, already told. This is the perineal branch of posterior femoral cutaneous, inferior cutaneous nerve of the rectal nerves. Okay. So again, we will discuss the pudendal nerve. Pudendal nerve is the main sensory and motor nerve. It is usually arises from the sacral plexus, that is S2, S3, anterior mi, S2, S3, S4. Usually the pudendal nerve is coarse. It is from between the piriformis, the coccygeus muscle, exit through the greater sciatic foramen at the location of posterior to the sacrospinous ligament. Then posteriorly, then just it basically you have to remember the location, just medial to the ischial spine. Okay, very important. This is the articular anatomy. Here is you have to give the pudendal block, like that is behind the sacrospinal ligament, just medial to the ischial spine. You have to give the pudendal nerve block. Another thing is the terminal. What are the terminal branch of the pudendal? They can ask. It is the first thing is the dorsal nerve of the clitoris, first branch. The second terminal branch is the perineal nerve, that is the again divided into 3 parts: posterior labial branch, muscular sensory to vestibule, lower ventral basena, and the inferior rectal nerve to external sphincter and perineal skin. These are the injury inferior. If you these are 3 branches, terminal branch of the pudendal nerve. If you injury to the inferior rectal branch, that will cause fecal incontinency. Okay, so basically these are the things you have to remember from this lectures. Okay, if you like this content, please subscribe. We'll discuss subsequent lecture series in next part. Thank you.